We'll do that. All right, we are now recording. So welcome everyone. I'm going to quickly share my screen. And hopefully you are all seeing this now. Let's start the slideshow. There we go. Okay. So welcome. I am Melissa Prest. I'm the foundation dietitian and your moderator for this session of one of our mini sessions of our Living with Kidney Disease and Transplant programs for November. Usually we have this as a one-day meeting, but with being a virtual, we wanted to break it up into smaller sessions instead. So the mission of the National Kidney Foundation of Illinois is to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. And so we want to thank our generous sponsors for today's meeting: DaVita Kidney Care, Fresenius Kidney Care, Gift of Hope Organ and Tissue Donor Network, Northwestern University Medicine, and UI Health. So to ask our panelists a question today, we ask that you use the chat button at the bottom of your screen. I will be going through the chat and asking your questions to our panelists. I also have some questions that I will be asking of the panelists to get the conversation started. And so these are all of our kidney disease and transplant mini sessions that we've had so far this month. We are currently on the healthy diet and lifestyle management discussion tonight. We have a networking night tomorrow, and then the patient panel on Thursday to wrap up our mini sessions for this month. We also are sending out surveys, so we just ask if you can complete the survey links when they are emailed to you. It helps to drive the programming for what we can offer to make sure that it is programming that is something that you would like to attend. And we also are looking for a new name for the Living with Kidney Disease and Transplant series. So if you have any suggestions, we ask that you email them to Rachel at rdepauw@nkfi.org by the end of this month, so that we can review the suggestions, and then a winner will be announced in 2021. If your name is chosen, you will receive a $100 Visa gift card. So I'm going to introduce to you your panel. So we have 3 different patients or people who are all living with chronic kidney disease. We have Nadia, who is currently not on dialysis. We have Candy, who is currently being treated with dialysis. And then we have Alexis, who has received the gift of a kidney. And so they're all going to talk with you about their life with the kidney diet and the lifestyle that goes along. And again, to share that things are probably things that you're also dealing with as someone living with kidney disease or have a family member who is living with kidney disease. Again, I'm Melissa Prest. I'm your moderator and the foundation dietitian. So I have a couple of slides to share first, just to give us a little background into the diet or some reasoning as to why we're doing what we're doing with the diet. So this first infographic is just to demonstrate how the filtering of blood by your kidneys decreases as kidney disease progresses. So you'll see that in stage 1, even though there's some slight damage or slight decline to your kidney function, your kidneys are functioning at basically a normal level. Once you start to decline to stage 2, you'll see that there is 4 less pints of blood that are being filtered by your kidneys than there were at stage 1. We normally aren't starting a lot of diet changes in stage 1 or 2, but they should still be things to start becoming aware of and mindful of. What we normally like to do at stage 1 and 2 is just general healthy care. So if you do have a condition like high blood pressure or diabetes, we want to make sure that those conditions are being really well managed, because having them well managed will help prevent or slow that decline of kidney disease. Now, stage 3, you'll notice this big difference between stage 1 and stage 3 in terms of how much blood is being filtered by your kidneys. And so we normally start to do diet changes at stage 3 and stage 4, stage 5. And so again, you'll see as it continues to go down, we're decreasing that kidney function, decreasing how much blood we're filtering. We're also decreasing the amount of urine that's being produced by the kidneys. And that's really important because your urine is how your body is getting rid of a lot of the waste products that your body has after it does various things for metabolism or other body processes. And so it's the reason why we make some diet modifications, because our bodies aren't able to clear the excess potassium or excess phosphorus in our diets like it once used to be able to do if the kidney function was functioning at a normal level. So this table is just very kind of a high level summary of some of the differences in the diet based on where you might be at your stage of chronic kidney disease. So we have our non-dialysis chronic kidney disease, those who are treated with dialysis, and people who are post-transplant. So protein, potassium, phosphorus, calcium, sodium, and fluid are probably the most common things that we talk about on a kidney diet. And there are so many P words that it gets really confusing for people to remember which food goes into which P words category. But at a high level summary, protein, so that would be beans or fish or chicken. Protein, if you're not on dialysis, somewhere about stage 3, we start to decrease the amount of protein that you're eating. And that just helps to preserve the kidney function a little bit longer by decreasing your protein. It just becomes a little harder for your kidneys to break down all of that excess acid that can be created from our animal-based proteins. And so we decrease the amount that we're giving. On dialysis, we're removing some of the protein when we do our dialysis treatment. So we need to replace that protein by the protein that we eat in our diet. And then post-transplant, generally, you're at just kind of a general level for a healthy individual. That's the RDA, or recommended daily allowance, is what the RDA stands for. So normally we're not really making a lot of tweaks to protein unless there's something going on that we need to take a look at. So potassium, we usually, when someone gets to dialysis, we're really cautious with potassium. We may restrict the potassium in your diet. And we may also restrict it a little bit in the pre-dialysis stage. And so a lot of that has to do, again, as we thought of that infographic where we see that decline in kidney function, our body's not clearing the potassium, the extra potassium from our diet, and we may start to see an increase in our potassium level. Now, there's many things that can cause your potassium to increase, so it may or may not be nutrition or diet related, but you may be asked to reduce some of your potassium-rich foods. Post-transplants, unless there's something going on with the kidney, and sometimes in the beginning when you get a transplant, some patients need a little bit of time for that kidney to start working at optimal capacity. So there may be some increases in potassium or phosphorus until the kidney really kicks in and is working really well. So you may or may not have a restriction with that, but generally it should be kind of the normal potassium intake. And potassium is going to be really rich in fruits and vegetables, but it's also really rich in our protein foods. So, a lot of times when we think of potassium, we think of potatoes or tomatoes, but it's also really high in things like chicken and fish. So we try to balance all of that out in the diet. And then phosphorus, that may be restricted in someone who's not on dialysis. We generally don't tend to see increases in our phosphorus levels until someone is closer to starting dialysis, and we 100% focus on phosphorus once someone is on dialysis. And again, post-transplant, unless there's something going on with the transplanted organ, generally we just have normal levels of phosphorus in our diet. Calcium, with that, we just want to make sure that in non-dialysis CKD that we're not having increased levels of calcium in our blood. I only put the actual levels for dialysis and post-transplant just to show that it's a little bit lower of calcium recommended for those who are on dialysis versus post-transplant. General healthy adults is about 1,000 milligrams of calcium a day. 1,200 milligrams if you're a woman age 51 or older or postmenopausal. And then sodium, a lot of times we're restricting sodium because of high blood pressure, but sodium also really loves to retain fluid. So it's kind of like this big sponge to soak and retain the fluid from things that we're drinking. So if you have increased fluid retention, your doctor may recommend for you to reduce not only fluid intake, but also sodium intake as well. And then fluids, depending on, again, what's going on with your kidneys, you may or may not have to restrict it before dialysis. Dialysis, we definitely decrease it because your kidneys aren't functioning enough to produce enough urine. And then post-transplant, I think the biggest thing I hear from people who are post-transplant is the amount of fluid they have to drink. Our kidneys love to stay hydrated. That's how they're going to work the best that they can after receiving a kidney transplant. So we want to make sure that people post-transplant drink a lot of fluid. So that's a very high level summary of some differences in the kidney diet based on the stage, but we are going to go into our panel discussion because that is what the whole session is about, but I wanted to provide that background information before we started. So I'm going to stop sharing my screen, pull the panel back up, and we'll start with some questions. All right, and the panel's all here. So let's get started. I'm going to go to, if I have any chat there, just to set myself up. Bear with me. Here's my questions. Okay, so for anyone on the panel, I'll call on you. I know sometimes doing these panels, it's always hard to know like who's going to start. But to start off with, when you found out that you had to be on a kidney diet or change your diet because of what's going on with your kidneys, what were some of the thoughts or feelings that you had, in hearing that from your provider? Candy, I think you want to talk. Do you want to go?
I'm like, it's so hard when you start. I would say it was really frustrating. It's already bad that you have to start on dialysis and then they instantly tell you, oh, you can't eat this or you can't eat that. So that was probably the most aggravating part. It's frustrating. It's frustrating.
Nadia, how about you? Anything, because I know that you're not on dialysis and you've been making a lot of just changes to, stay as healthy as you can and, kind of keep your kidney disease stable. So what kind of thoughts or feelings did you have when you started making those changes?
Well, one of the things was, it was funny because that was right after, actually a few years after I was diagnosed with diabetes, and I was going through those changes with my eating habits as well. So the first thing that came to my mind was more restrictions. And I hadn't really grasped a hold to what kind of restrictions I needed to make, excuse me, or changes I needed to make as far as kidney disease. I hadn't wrapped my head around that. So I hadn't really wrapped my head around diabetes just yet. And then I found out I had to wrap my head around another issue where I'm going to have to do going ahead with my chronic kidney disease. The next thing I had to do, the only thing in my mind I thought about was I had to reduce sodium, because that's all you hear about was kidney disease, your sodium and your blood pressure and your blood sugar. That's all you heard about. It wasn't until I further learned, you had to learn about things like phosphorus and potassium and things of that nature from going to classes and reading on the website DaVita, that I had to learn about those things. So when I found out those things I had to learn about, then that became a little bit more challenging, because it's like, I had to go back to reading labels for not just for carbohydrates and not just for sugars and things. I had to read things for phosphorus as well. And to see how many things have phosphorus in it is like, it put me at another limit as to what I could have. I was like, wow. I'm like, you never know how much stuff has what you can't have in it until you actually have to be at the point where you can't have it. And you never know, like things have so many things that phosphorus, things that are sugar free for you. Yeah, you can have it for your diabetes side, but wait, you can't have it for your kidney side. So
Yeah, and I know a lot of the patients that I have worked with on dialysis, have all said, well, I can't eat anything because there's nothing left to eat. And I think a lot of the people that I talk to not on dialysis are really fearful, because there's a lot of different food lists out there of what to eat, what not to eat, and then they all contradict one another. And so I think for some people, they're kind of over restricting, or they're very afraid of the foods that they're going to eat to hurt their kidneys. So it's definitely a challenge. And I appreciate you for sharing that, because I do agree that that is a challenge for a lot of people when working with the diet. And Alexis, I see your head shaking yes over there. So
You know, when I was going through dialysis and everything, it was very frustrating because I was one of those people. And I was like, well, what's left to eat? Like you know, there's so many things that you can't eat. But since I've had my transplant, I've worked with a lot of trainers, because, you know, once I started working out and everything, I tried to figure out like what to eat. I run a lot of things past my transplant coordinator, who's amazing, who helps me out a lot. But I would say at this stage now, I've actually been having a little fun with it, only because I'm learning to experiment more with things I know I can have. So there were a lot of things that I never would even think about eating before that I eat now. I am sodium restricted, mainly, you know, for myself, and I do have high blood pressure. I never had it before, but I had it once. I got it once I had the transplant. And so I'm learning to cook with different herbs, and, you know, lemons and limes, and, you know, a lot of fresh things. So it's been kind of cool now because I'm able to experiment, and I was able to add some things back. But in the beginning, it was very frustrating because I pretty much ate the same thing every day. It was like boiled chicken and a little bit of rice, I think is what I was eating at work. So with literally nothing on it. So it was definitely frustrating.
yeah. So what were some of the easiest parts of the diet for anyone to change? Was there anything that was easy about it, or was it all just challenging?
I think once I learned what I could do, it became easy.
Mhm.
And I have to agree with Lex, once you learn how to prepare your meals, and that's what it's been the easiest now. I've learned how to prepare my meals. I've learned what to watch out for. Coming to classes and learning how much sodium I can have. It's not there is not so much restricted right now. I've learned about fresh fruits and vegetables and things that I can prepare. When you look at things now and how you can have a lot, learning that freshness is the best. A lot of prepackaged foods, a lot of things that I do like. Davia does a wonderful job of creating recipes for you that you can have and telling you how to prepare them in a way that's very kidney friendly. And I appreciate that website that does that. So then when you look at things another way, it's like, oh, for instance, I remember when I was in the class with you with the kidney seminar, I wanted to make vegetarian tacos. Well, I was able to get the pinto beans from Walmart. They have zero sodium. I learned about making the grits that I like in the canister. They have zero sodium. So it's just preparing things differently. So I learned is just when it's less restricted, it's not as challenging anymore.
Awesome. Thank you. Yeah. And I know, like, when I always like to start asking people, what do you like to eat? Let's start from what do you actually eat and what do you like to eat, versus looking at these lists of things that you can't eat. Because I think a lot of times, you know, people might see these lists of no's and get fixated on that. And it's really more of thinking of like, okay, what do I actually like to eat? And do those fit on my kidney diet still? And how can we work them in? So I do like that you're taking what you can do and then just kind of going with it from there.
I
Candy,
think
how about, oh, sorry, Alexis, go on.
I was just gonna say, I think Nadia hit it on the head. The key is doing meal prep and preparing your own food. I do a lot of that. Twice a week, I'll prepare enough food to last me a couple of days, put them in small containers. And when I get ready to go to work for the day, I just kind of, even my snacks, and I just kind of grab everything, put it in my bag and take it to work. It helps you save a lot of money because we know eating expensive. But also then you know what you're putting in your mouth. You know that you prepared it, you know how you prepared it, you know what's in it. So that is definitely key, you know, trying as much as possible to prepare your meals and your snacks.
Candy, anything to add? Because I know with dialysis, that's a huge change.
I know, like, oh, they're so positive about this easy. Is nothing's easy for me with it because I think it's because I'm on dialysis.
Mhm.
Not only am I on dialysis, but I was always very heavy. So um, that prevented me from getting on a transplant list at the very beginning. So everything seemed to be hard for me when it came to eating as well. So plus, I would say like after I realized it was going to be really difficult. I'm not a diabetic, so I didn't have to really worry about the sugar intake that in that sense. But with the peritoneal dialysis, it was a sugar solution, so it's still going in my body, which was a concern to me. So eventually, I had gastric bypass surgery, and that was so that I could eventually get on a transplant list and not have to deal with the diabetes or the high blood pressure, which I still ended up having high blood pressure even after the gastric bypass. But that created another problem too because now I have a high oxalate level. So you have food that you can not eat because you're on dialysis, which is things that are high in phosphorus and stuff like that. So then with the high oxalate, you have things that you can't eat on this level. So let's say I can't eat spinach or I can't eat any green leafy vegetables. So first you want me to eat vegetables, now you tell me I can't eat vegetables. And then you want me to eat this, and then you tell me I can't eat this. So literally there is absolutely nothing really that I can just say I can just eat, other than probably like Alexa said, rice or chicken. I can have that,
That's a
but
good one.
absolutely nothing else. And even with having gastric bypass, so I said, so I can eat this much food, but then I can't eat it. It does help a little bit though, because I'm only taking in a small amount of food. So I can kind of sneak things that I probably a normal person could not eat. So I mean, there's some give and takes, but it's just not easy. Not in my life.
Well, I definitely appreciate you sharing. And, and absolutely, I think dialysis is the most restrictive of all the different parts of the kidney diet. So that is always the one that's hardest for people living with kidney disease to manage, and rightfully so. There's a lot of different things that have to get managed with that one. We did have a question from one of the participants, actually two. So one is, when you start post-transplant medications that disrupt your metabolism, especially prednisone, insulin needs skyrocket, resulting in weight gain, even with limited caloric intake. What is the best strategy? So I will say a lot of times those medications will increase your appetite, which has a lot to do with a lot of the weight gain that is seen. But Alexis, what has been your strategy with weight management? I know you said you're exercising and working with a trainer, and exercise itself will help decrease insulin levels. So it's always good if you are having issues with blood sugar, and that if you eat, get in some exercise, even if it's just walking for a little bit after you eat, that's actually going to help your body naturally decrease your glucose levels. So that's one way you can kind of help with that insulin. And then also, changing some of the foods that you're eating to address that increase in blood sugar, kind of the same way you would manage something with diabetes. But Alexis, what kind of strategies have you been
For, for
doing?
me, the best thing that has worked is because when I first started, I was just, I was working out, but I was still, eating normally. And what I found that worked for me is to break my meals up into smaller meals, and I eat 5 or 6 meals a day. And that includes, my snacks and everything. And what I find is when I do that, that speeds my metabolism up. So that helps me to keep my weight at a certain balance. What I find, like right now, since I started the new job, I don't get to eat like that anymore. So I have picked up a few pounds. So I'm going back now to preparing my meals. And sometimes in between my flight, if I just go and put a couple of scoops in my mouth before my next flight, then that's what I do. But I find that that actually works better for me, because when you do that, again, it speeds your metabolism up. A lot of people think if you eat, 2 meals a day or 3 meals a day, For the average person, it might work, but for us, because of those medications, your metabolism is still slow. The key is to speed it up. So, and the other thing is I try not to eat anything really late, you know, after a certain time. I try not to eat late. Um, and then the other thing I would say is, I mean, because I'm a foodie, I like to go out to eat. I can't tell a lie. Um, but I keep that at a minimum. And, you know, I do like a cheat meal, not a cheat day. You hear people say a lot of times, you know, do a cheat. It's my cheat day. I can eat what I want. You can mess up everything that you did that week by doing a cheat day. So just do a cheat meal and have something that, you know, that you like, whether it's something you prepare or you go out to eat or whatever. And that helps, but it's not easy at all. I mean, I tend to, you know, fluctuate when I'm working out a lot. I do really well. But, you know, like since COVID's happened, I haven't really been able to work out like I normally would. So it's been tough, you know, I think for all of us. So but that's
No,
what
that's great. Yeah,
Mhm.
thank you. Yeah, I like to call it a treat meal.
Yeah.
A little treat.
Mhm.
So there was actually another question for Alexis. Were you on a restricted diet after you um, received your kidney transplant?
I was for a short period of time because the kidney that I got, they told me that I was going to have high antibodies to it. So I had to go through a lot of treatments for about 3 or 4 months. And they left my peritoneal catheter in until I think it was like maybe 5 or 6 months, and they took it out. So they wanted to make sure that I was good. So I was able to eat a little more, but I had to gradually start adding some things back. So it's like I couldn't just go out and eat a whole pizza like I would love to. I had to kind of gradually start working my way back into some of those things. And I learned that, you know, some of those things I didn't have to have. Because I just kind of felt like I changed. Like I used to be a dessert person. So I would go out to eat and I'd have my dessert before I'd have my meal. Now I really don't care if I have dessert. And if I do, I usually, you know, if I'm out with some people, like we'll share something. And I'm very sensitive to salt and sugar. So there were just certain things I just had to cut out because you know, even, you know, like Nadia said, when you read those labels, it's amazing. If you buy something that's low sodium, it's loaded with sugar. If it's, you know, low sugar, it's loaded with sodium. So, because they got to make it up somewhere. Everybody now is eating those Impossible burgers and they're delicious, but they have a ton of sodium in it. So, for me, I had to sort of gradually add back, but it probably was about 4 or 5 months before I could like really start, you know, adding more stuff back.
Yeah, and I know that it depends on the person in terms of what happens post transplant. So when I was working in the dialysis center, we had a few patients that had come back to the dialysis center for a few treatments after receiving the kidney transplant until, you know, kind of that kidney wakes up or is like going to start to work for that person. And then there's been other patients that we've had, you know, in dialysis that received that kidney and they were kind of you know, doing fine after, you know, they were discharged from the hospital. So everyone's a little bit different. And so, you know, it just kind of depends on you as to what's going on with the kidney. And then again, like Alexis was saying, depending on, you know, with her specific case, that there were some restrictions still a little bit in the beginning.
I will say, like right after the transplant and once the kidney started working, I was really hungry, like all the time. And I don't know if that was sort of, you know, the back end of being on that very restrictive dialysis diet, but like you're really hungry for a while. So it's kind of hard to control it, but they definitely kind of kept me at a minimum until I gradually added the stuff back.
So we are going into the holidays. So how do you navigate the holidays with family and friends? Now I know this year's a little different because we're likely not really going to be getting together as we normally do, but when we do get together, when we have been getting together, how do you navigate the kidney diet at your, you know, at those holiday events or at those events when you're getting together with friends or family? Candy, I'll start with you.
Okay. We usually do our own cooking. So it's me and my husband. So we usually have the things that the kids like and the things that I like. And I usually just stay away from the things that are mostly high in phosphorus, because that's what I have the issues at. My issue is more of high phosphorus items. I don't have a potassium issue because it's peritoneal dialysis, so we don't really have to worry about the potassium as much. And I don't have to worry about the sugar intake, but I don't really eat sugar anyway because of the surgery. So
Mhm.
it's not as hard. And believe it or not, your family are is very understanding. I've been doing this for a while, so they kind of know. They don't push, as long as you have what they want, they're happy.
Nadia, how about you?
It's my mom and I, so it's really easy. We both are working to be healthy. So that's the good thing about it. We prepare the meal here at home, and anything we get, we monitor what we get if we're going to purchase anything. But most of the time, it's prepared here at home. It's prepared like it's supposed to be prepared, low sodium, low sugar, and things of that nature. So we prepare our meals here at home.
Okay, great. Alexis?
For me, it's a little harder because I won't be this year. This year will be easy because I'll end up having to cook my own meal. But normally, we spend Thanksgiving at my cousin's house, and they prepare a lot of food. Like there's a whole room just for desserts. It's a lot of food. But what I normally try to do is, when like my first plate is mostly greens, and then I'll have like a little turkey or something like that. And then I try to go back and get a little bit of the different things. Like I like ham, but I really only eat it usually Easter and Thanksgiving and maybe Christmas. So I'll make sure I have a little bit of that. I try to just have like a little bit of some of the other things that I like. I don't overdo it. And that's the one time where I definitely will have some desserts because they're really good. And again, it's just like a little bit of a few things, and then after that I'm done. I don't bring any food home with me, so whatever I eat there, that's it. Once I come home, I'm right back on my own program and I'm eating what's in my refrigerator. So I try not to deprive myself, but I try to also monitor how much I'm actually eating. So
Yeah, I think that's smart. And I always encourage people to really think about what are my favorite foods. Like sometimes, you sit down and you see food and you're like, I'm just going to eat all of this, but you may or may not actually like all of the food that's like really like what's all the food that's on your plate. And so I generally encourage people to, like, if you really, really like macaroni and cheese, and we know this is going to be higher in salt and higher in phosphorus, and you're working really hard on phosphorus, maybe you're just having a little portion of the macaroni and cheese, and then the rest of your plate you're filling up on those lower potassium foods, lower phosphorus foods, and you're focusing on those as that bigger portion, but allowing yourself to have a little treat of those foods that you still really do enjoy and get to enjoy at that holiday meal. So yeah, thank you. Let's see, talked about that one. So how has working with your healthcare team helped you in making diet and lifestyle changes? So I know, Alexis, you had mentioned the transplant coordinator has been really helpful for you. But any other thoughts just on your journey in general on having chronic kidney disease and kind of that the role in which that healthcare plays for helping?
I mean, again, my coordinator is really well, my nephrologist, and I happen to have two because I have one here in Chicago, and then I have the one that I have in Madison where I have my transplant. And they're both very good as well. They're very good about explaining, a lot of, do's and don'ts to me. Um, and like I say, I've been blessed that the people that I've worked with outside of that have been really good. When I picked my trainers, I made sure that they knew my situation, and they were really good about doing their research. So if they were, okay, you're boxing now, so I need you to, I want to change your diet to this. They've looked it up, they've researched it, so they know, exactly what they're telling me to eat or cut out, and making sure that I still have, what I need to make sure that I'm healthy. So um, for me, those have been the key. Just my physicians, like I said, my transplant coordinator and the trainers that I work with are, all the ones that I've worked with since I've had my transplant have been just amazing. And like I say, really make sure that they do their research and they know exactly what they're telling me and they're not treating me like I'm just a regular client. They understand my situation. So
Thank you. Candy, how about you?
Would say my dietitian is great. She's really good at just making sure that, because I always have a protein issue, which I take that back. I've had a protein issue in the last year where for some reason I'm just not getting enough protein in. Either my dialysis is pulling way more than I need to, so I'm constantly trying to figure out a way to get more protein in, and I don't like protein shakes because they're so sweet.
Mhm.
And with the surgery, it just doesn't match very well. So she's really good at encouraging, like, boil some eggs, have a egg as a snack. A couple times a day, like maybe one for breakfast, one for lunch. And I've noticed that that really has helped. So she does a really good job at, just encouraging and pushing and, changing. I'm a cheese eater. Like I love cheese. Like pizza is my favorite thing. Like when I first started this process, I was like, oh my God, like you really want me to give up a slice of pizza. So we talk about that a lot, just, or, not being able to have bacon. She's like, okay, Candy, if I let you have a slice of bacon, will you just add a scrambled egg with it? So you're still getting the things, you can't do this, but you can have it just in moderation and making sure take your phosphorus binders. She's really good at going over my labs every month and saying what I need to fix or change or add stuff or with calcium or anything. So I would just say the team of people, just like Alexa said, you have good people working with you, it really helps.
Thank you. Nadia, how about you? What do you think?
So yes, I had my kidney nutritionist who works with my nephrologist, and then my nephrologist works with my primary care physician, and my primary care physician works with my endocrinologist, and they all work together. My kidney nutritionist saw me and she sat down with me, went over my labs and went over with me how things were working. And she stated that I was doing very well with my kidney disease in the stage that I'm in, and that I didn't have to have any restrictions, and always left her door open to me that if I had any questions that I wanted to come to her about, that I could always come to her and I didn't have to, wait till I moved up her stage or anything, that she was always readily available to me for any kind of questions that I had. She does review my labs as well, make sure that everything is staying in the stage that it's in and that nothing is rising or anything that she needs to be concerned about, make sure there's no restrictions I need to go on. And also she talks to my nephrologist back and forth, and my nephrologist and my primary care physician do a great job of talking to each other regarding my iron count and my fluid count to make sure they have the LASIK is being medication is being given correctly, and that my iron medication is being given correctly. So
Great.
I like the fact, I like the camaraderie they have amongst each other.
Yeah. And it's important that, the patient's kind of at center of the care team and everyone's helping and coordinating that around to make sure that you as the patient in person are, being the most successful that you can with all of the therapies and treatments. I know I would struggle a lot with giving up cheese. I love cheese. That would be
And
so
if there's
hard.
and if there's a lab test that my nephrologist needs to run that my primary care physician can run, he does allow her to run the test, and then they have Epic, so they can
Mhm.
look across the 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 computer to see what tests have been running the results.
So thank you all so much. What talk about your support systems that you have in place to help you. I know you've also that your family's been really supportive, which I think is great. I know sometimes the people that are closest to you aren't always as supportive. So I don't know if you have any tips to share if someone is in a situation where maybe those people that aren't as supportive as you might need them to be or want them to be. Any tips that you can share for someone navigating that type of situation?
The National Kidney Foundation has the mentoring program, which
Mm-hmm.
people can use to maybe talk to someone else that's going through the same process that can maybe help. I see we all do have really good support systems, but I have run into people that don't have people that they can talk to or discuss things with. So I would think that would be a good option after maybe talking to their team and seeing, maybe they could partner up with somebody at their center or discuss things with them.
Great, thank you.
That's true. I know. I do have my mom as my support system. She works with me in checking phosphorus because the first thing she'll ask me, two questions she always asks: what's the sodium count, and is there any phosphorus in there? She reminds me to check those things, and that's very helpful to me in checking those things and keeping me accountable. But like Candy was saying, always check with your physician and your team, and also most hospitals have social workers that you can reach out to and see if they have anyone that they can talk to. Sometimes they have groups that you can get in touch with. And also reach out to the National Kidney Foundation of Illinois as well. They have groups and support groups that you can reach out to as well.
Thanks. Alexis, anything to add?
I would just say I would agree with both of them. I mean, I was very blessed that I did and still do have a very good support system. I think, initially, there's that fear because you don't know how much to say, who to tell. You might not want your job to know different things like that. But I have to say that even like with my job at the time, they were incredibly understanding. And I mean, there were a couple times where I had to go to the hospital and my boss drove me, or one of my friends who's a manager drove me. So I think it's very important to reach out to some of the places that they've recommended, the Kidney Foundation, the social workers, and things like that, because the key thing is to know you're not alone. And we have not because we ask not, and so you have to speak up, you have to say something, and there's going to be someone there that can help support you, but you got to ask for that support. So
Thank you all for sharing. That was great. So I know, Nadia, you were talking a little bit about DaVita's website and the recipes there. What resources have you found for everyone, but most valuable when learning about the kidney diet?
I found the DaVita to be very, very helpful because they have recipes. When I first found DaVita, they had just started like setting up the website. Early in my kidney disease, they had just really started setting up the website, and they just had a few little recipes, like a little booklet they send out to you. But this website has really developed over the years. They even come out with recipes for like the seasons. They like summer recipes, they have fall recipes. They've broken it down into ethnicity, the holiday recipes. I mean, they've really, really broken it down, and they've even broken it down by like phosphorus, dialysis patients, non-dialysis patients. They've broken it down by kidney stages. I mean, it's really an excellent website to go to for a resource when you want to decide what recipes you want to go to. It tailors to every kind of kidney diseases stage. So if you're in stage 1, stage 2, has recipes for that. It asks you what stage you are, if you're non-dialysis, if you're dialysis. I mean, it really breaks it down to you. It gives you a list of recipes. You can download a little cookbook for yourself. So DaVita has really been a good help for me.
Great, thank you. Candy, how about you?
I would say I've used kidney.org a lot. They have it broke down in like with the high phosphorus items, low phosphorus items. The hardest part for me was trying to find out oxalate issues and having to do a lot of Googling and researching. But with just the dialysis part, I would say kidney.org was the best for me, other than my dietitian who always is giving out recipes or showing me different ways of doing stuff or changing up things. I would say it's probably the best resource. I didn't know about the DaVita though. That's like
that's great information.
I was like, that's awesome. But I will be checking that out.
Yeah, DaVita has a lot of good resources. I always encourage patients to go to the AAKP, which is the American Association of Kidney Patients. They have links to a lot of different, like DaVita, Fresenius, Northwest Kidney Centers. They have links to a couple of different websites that have various recipes and information, kidney.org. So they have like a one-stop shop on there as well with the AAKP. So that's another website that I like to recommend for people.
AAKP sends a lot of emails too. I do know that, like, they'll send you updates, like even when they have like Zoom meetings and webinars and stuff lately. They've been doing a lot of that. They are.
DaVita sends you emails too. DaVita will send you emails, updates about courses, classes. They also send you emails about recipes as well. You give them your email address, they'll send you updates too.
Alexis, how about you?
For me, I mean, I know initially I used to have, and I don't know if you guys still have it, there was an app that you could download from the Kidney Foundation that had like the different things that, like you say, you broke it down, different things that you could have, and then it had some recipes in there. I used to use that a lot. I use the website, but since my transplant, I've just been doing a lot of research, just trying to find things that work for me. I know what I like to eat. I will say I've expanded some of the things that I like to eat. I've tried to go mostly plant-based. I have not, Candy, been able to give up the bacon. That is what's keeping me from being, going to
have this bacon, cheese.
Oh yeah. But but I actually, and I remember when I first tried it, like I kind of beat myself up, and then my nephrologist was like, look, if you've gone 60-65% plant-based, that's good enough. And so I had to really think about that. And I'm like, okay, well, I'm probably about, maybe 70-75% right now. But there's just certain things that I just haven't been able to give up, but I only eat them, every once in a while. So I don't cook bacon at home or, whatever. So for me, it's just been a lot of research, reading different books about, just different meal plans and just trying to figure out what works for my body, because all of our bodies are different. And so what works for me may not work for somebody else. So, but it's just about doing research. And again, I use my coordinator for a lot of stuff. If there's something that I want to try, I'll run it past her. If she says yes, I'm for it. If she says no, then I cut it. So, so just research for me.
Thank you. Let's see what else I have on for my questions. And if anyone has any questions, please use the chat feature. I think we've gone through most of the questions, or I've touched on them in some way in our discussions here today. Anything that you feel, if someone could give you tips if you were just starting out again, what are some tips or things you wish you would have known about when you were being diagnosed or going through either starting dialysis or having the kidney transplant, or as you're diagnosed with CKD? Are there tips that you wish someone would have shared with you?
That your life is not over. When I first was diagnosed, I felt like that was it, that that my life was over because I have chronic kidney disease. It was never really explained to me. All they said was you have stage 3 chronic kidney disease, and it just, when you hear it, when you hear kidney disease, you just in your kidneys, you always hear about how your kidneys are so sensitive, and the first thing you think about is dialysis. It's all you automatically think, and you never hear about the stages. Get some information, find out facts first, and realize the stages, even if you have to research for yourself. When I found out, Google and all the internet and stuff like that wasn't as prevalent as it is now. So we have Google, we have WebMD. I would say find out first what you can about it, and then take those questions back to your doctor. Learn about the test, get with the National Kidney Foundation of Illinois website, the DaVita, whatever website you can find. Even if you just Google kidney disease, whatever you want to do, you can find information now that I didn't have then. And then you can see that chronic kidney disease, whatever stage they say you have, is not a death sentence. I've been stage 3 for 6 years. And when my doctor twice a year runs my labs and we see that I'm still stage 3, we go, yay, it's a happy thing. That's what we're excited about, that I haven't moved to stage 4 or that I haven't moved to dialysis. So those are the kind of things. There's some restrictions you have that you have, but those restrictions are to save your kidneys from getting worse and from going further. So just being more informed is what I would say I would have to give tips on.
Great, thank you. Alexis, how about you?
I think for me, early on, because I mean, by the time I got a diagnosis, I was missing half my kidney function. So, and I had no symptoms and I wasn't sick or anything like that. So I think for me, when they told me, when they first started telling me that, I had kidney disease and then going through the process of getting a diagnosis, I was in denial for most of it. I would say that, nothing really hit me in the face until I crashed into dialysis. And so I would say take advantages, like Nadia said, all the resources. Try to really hear what I was, lucky my mom went to most of my appointments with me. And I was really glad that she did, because they were talking to me and it was literally going in one ear, not the other, because I was in such denial. But my mom was listening to everything. But I didn't really utilize any of the resources like I should have, I don't think. I mean, I think I continued to try to take as best care of myself as I could, but I did not use the resources, I think, like I should have. So I would say utilize your resources and ask questions. Once I hit dialysis and things got really serious, I used to keep a notebook and I would write down, if something wasn't right, something was wrong, whatever. So every time I went to the doctor, I had in front of me, hey, this is going on, this is going on. Like, it's your body and nobody knows it the way that you do. So you definitely want to, make note of that, discuss those things with your doctor and utilize resources as much as you can.
Thank you. Candy, how about you?
Say, don't be as hard on yourself. I think sometimes the first thing you do, you hear dialysis and you just get crazy and you like, what in the world? In my situation was totally different. I was up under a doctor. I was never sick. I ended up in the emergency room for one issue, and the next thing you know, I was in end-stage renal disease and failure. And the interesting thing about my situation is that my husband is actually on dialysis too. So he went on dialysis in March of 2008, and I went on in May of 2008. We had three little kids, and our whole life had changed like instantly. It just shows you, it's interesting how people say, "Oh, COVID," and I'm thinking, well, no, life changes for other people prior to COVID stuff. Like some of us go through like these things way before, but what I had to tell myself is that everything happens for a reason. Um, if I can help just one person, then I've done what I'm supposed to do, because someone doesn't have what I have and they don't have, like you say, the support system, people to help them. So I'm always willing to just like be out there and help and figure out a way and teach. And that we all can live through it and you don't have to just give up. So, you know, we're our prime examples. Like I am like so shocked. Nadia is like awesome. She's had all these opportunities to just make sure things go in the right direction for her. And sometimes we think we don't have the option, so we don't even try. We just like, oh, you're telling me I'm gonna lose my kidneys eventually, so I'm not gonna worry about it. I'm just gonna, like she said, so like Alexa say, some people just don't listen, and they're just like, I'm not gonna worry about it. So it's just amazing how things just turn out.
Can I just say one more thing too?
Of
I'm sorry.
course.
I
Yeah.
also want people to know that, because I've had my transplant and I am about 8.5 years out. And I would want to share with people that just because you have your transplant doesn't mean it's over and you're done. Like, there's so much involved in staying healthy, and making sure that your kidney is good. There's a lot of follow up. There's, the medication. I mean, anybody would be able to attest the amount of medication that you have to take, and taking it on time and all of that. I think people need to know that, so that if they know what they're getting into, it's a wonderful thing. Don't get me wrong, but you're still going to be working at it. So like all the work that we're putting into eating right now and all this other kind of stuff, all of that continues over. And once you've had your transplant, you don't stop any of that stuff, and you actually have to do more. So it's important to know, for people to know that it's not over once you get it and you can go back to your normal life. There's a lot to do to make sure your kidney stays healthy. So
Thank you for sharing. And we had one of the attendees said that they had a similar experience to you, Alexis. She was in denial until she received her transplant. So, and I think that's true for a lot of people. And a lot of people do kind of, like we said, crash into dialysis. And, I wish more patients had, I guess, more care and follow up with the kidney disease prior to that. And there's obviously a variety of reasons for that. So it is, I commend again, Nadia, for having all of that, the care and really taking care of and maintaining the kidneys at stage 3. And that is always one of the things that we talk about and encourage with people that, with the right treatment and management, you can delay that progression of kidney disease. And like Nadia said, you can live with this. Your life isn't over. It's just different. And it's you're kind of making a new normal for yourself. And I've been thinking a lot about how, with this pandemic and the situation that we are in, it's almost a time for a lot of people who don't have a chronic illness to kind of see, oh, this is actually what life can be a little bit like, that change in life that people who are living with chronic illnesses have gone through, like Candy said, and that frustration and that fear and that anger that goes along with it, is something for people that have chronic illnesses I've been living with for a long time. So I'm sure for a lot of people, they've made an easier adjustment with coronavirus because they're used to kind of these crazy changes in their lives. But it is a very interesting time for everyone. And so I do appreciate all of you for
Melissa,
sharing and being with us today.
thing?
Yes, please, Nadia, please.
I just wanted to say, along with reading labels of food, read labels on medication, because that's how I got my chronic kidney disease. Ibuprofen, too much ibuprofen is what damaged my kidneys. So if you see a medication label where it says could cause kidney damage or may affect your kidneys, be mindful of that, because too much of a good thing is not good. Whereas some medications may be good for a temporal moment, long-term effects can cause damages to the body. So if you see something where it says may cause kidney damage or things of that nature, just be mindful of that, because that's how I got my kidney disease. Just wanted to let people know that.
Thank you for sharing that.
That goes for some herbs and different things like
Yeah.
that. Like a lot of things that people take over the counter, vitamins and things like that. They have to be careful with those too.
Well, I want to thank all of our panelists and all of you for attending and joining us. We are right at the top of the hour, so I am going to end our meeting. But thank you so much, Candy and Nadia and Alexis. It's been great having you with us for this past hour and sharing your stories and all of those great things that you're doing to really manage and, I would say, thrive with kidney disease, no matter what stage that you are at. So thank you so much.
Thank you. Everyone have a great night and a great holiday. Stay safe.
Thank you.